Healthcare costs in the United States are skyrocketing, with no sign of relief for working American families and their employers. No one wants to be sick, but no one seems to know how to get well either.
I had 4 stents put in my heart.
I was put on blood pressure medicine about 1.5 years ago.
I have high cholesterol. I want to lower my cholesterol.
I'm on 10 medications. I have high blood pressure, high cholesterol. I'm a diabetic.
I have high blood pressure, diabetes, high cholesterol, and my mom's had all the same things. She's had stents put in her heart. It's just not the way that I want to get old.
These are real people with real problems. And the real solution is Dr. John McDougall's Healthy Employee Immersion program in Santa Rosa, California. Dr. McDougall has over 35 years' experience reversing and curing lifestyle issues like high blood pressure, high cholesterol, diabetes, and many others.
Estimates are that 3/4 of our health care costs are from chronic diseases. And most of these chronic diseases are due to diet, to what people eat. We're talking about heart disease, coronary artery disease. We're talking about type 2 diabetes, obesity, hypertension, elevated cholesterol, all kinds of intestinal problems from indigestion to constipation, multiple sclerosis, various forms of arthritis, including serious arthritis like rheumatoid arthritis. Not only can these be prevented, but even after people get sick, if you change their diet, what happens is most of them get well.
Five 5% of your employees can be responsible for 75% of your medical costs. Helping that 5% become healthy can significantly lower your healthcare expenses. Dr. McDougall's Healthy Employee Immersion program is a proven way to get your most at-risk employees healthy. Dr. McDougall's program has been extensively studied, with the impressive results documented in medical journals. Several major corporations have trusted the health of their employees to Dr. McDougall's Immersion program. Companies like Public Supermarkets, Blue Cross Blue Shield of Minnesota, and Whole Foods Market. Dr. McDougall's program can dramatically reduce the cost of employee health care.
I had a chance to take care of the employees of Blue Cross Blue Shield of Minnesota. And I took care of these groups of employees for a year at a time, 3 groups of people. And what we found is the average reduction in healthcare costs based on their claims data was 44% in 1 year.
Dr. McDougall's program doesn't just save money, it saves lives.
Dr. McDougall has just made a huge difference in hundreds of team members that at Whole Foods have gone through his program.
I think of all the benefits we get at Whole Foods, this is by far the best one.
His program works. If you do his program, it will, if you follow it, you'll be healthy.
Here is how Dr. McDougall's program works.
I run 10-day residential immersion McDougall programs. That's where people come and stay with me for a period of time. This is a medically supervised program. Doctors see every participant. We go over their problems, their medications.
It is medically supervised, and everyone who comes in gets an initial medical assessment by a licensed physician. You sit down with us for a good half hour. We review your medical history, we do a physical examination, and then we talk specifically about what's really happening in the individual's body and how the diet that they're going to be eating during this program and hopefully when they leave here is going to affect their medical care.
During the program, we educate people about the importance of good food. That's the main message about the program, because that's the main problem. People are sick because of what they eat. So we teach them about eating well. That education comes in the form of lectures, it comes in the form of cooking classes, it also comes in the form of dining experiences. We serve them the right food. They find out it's delicious. They can eat as much as they want. They lose excess weight. They feel better. Their cholesterol comes down. Their blood pressure comes down. It's an experience that lasts for a lifetime. We also have education in terms of exercise. We have a psychologist who teaches people why they act the way they act, why they choose the foods that they choose, and how to change those behaviors.
When they come here, they're not sure what they're getting into. They know that they're in for a week of healthy living, and they're not even 100% sure that that's what they want to do for the week. And then when they start to get introduced to the ideas and the food, I watched them make their first tentative steps and basically starting to think, you know what, maybe I can do this, but maybe I can't. This might be a little too hard for me. I'm not sure that I'm going to be able to pull this off. What we get to see is the growing confidence that this is something that they can do, that they don't have to do it perfectly, but they can do it well.
We also have an expert dietitian who tells people about the components of food and how to really understand what they're eating and how to make a difference in what they eat.
I start out by taking a big picture, a bird's eye view, stepping back and trying to show everybody exactly what's happened to us in the last 30 years. What are the changes that have happened in our environment, in our diet, in our lifestyle that have contributed to the problem? We're not about managing the disease, we're really showing people what is truly causing their diseases, what's causing them to be overweight. I also do a cooking class where I actually show them how they could get into the kitchen, and in just 10 minutes a day they could cook meals that require very little skill, food that can be bought anywhere, can be done very inexpensively, and are very filling and satisfying. I teach them classes how to actually go into the supermarket and find the healthiest foods, and how to become aware of all the marketing and advertising tricks that are done.
It's a comprehensive program. Our medical doctors also provide a tremendous amount of education, and this education gets very personal, like why are you taking these blood pressure pills, and should you continue, and why are you taking cholesterol medications, and is it best for you? Our doctors know about good nutrition. They also know about the science behind medicine, medications, and various surgeries. And they give them information that causes them to make decisions that are evidence-based and result in much better outcomes than they're going through right now.
After just 5 days in Dr. McDougall's Immersion program, his patients already show dramatic improvements in their risk factor profiles.
My cholesterol started at 202. Today, 5 days later, it has dropped down to 143, so it's gone down 59, which is crazy, unbelievable. Also, from my waist, I've lost 3.5 inches, and I've dropped about 3 pounds. And I've been eating like a little piggy, so it's been amazing. I can hardly believe it.
I'm off of all of my medicines. I came here taking 7 pills a day, and I'm going home not taking any of them.
I haven't taken blood pressure medicine since I've gotten here.
Blood glucose dropped by 19 points, and I am no longer on the medication that I came to the program with.
I've lost 12.5 pounds in 5 days, which is amazing to me.
I lost 5 pounds, dropped my cholesterol 40 points, and lost 3.25 inches from my waistline.
I was on about 6 medications, and now I'm down to 3.
The amazing thing is we've done it by eating as much food as we want to.
I know.
I mean, to the point where we're just full every meal.
I feel great. I've been here 5 days. I've lost 4 pounds. My blood pressure is down 40 points. And I feel like this is a very positive experience for me and a life-changing one. I really do believe that.
I dropped my total cholesterol by 50 points, and I've lost 3 pounds.
My cholesterol went down 90 points. I've lost 4 pounds, 4 inches on my waist.
My blood pressure now, without any medication, is for the last 2 days been 120/80. So I couldn't be more ecstatic in terms of if these are the kind of results that somebody could see after 5 days. And I ate. I did not cut back.
These are not unusual results. They are typical results for the thousands of participants in Dr. McDougall's Immersion program. Checking in on participants after graduating from the McDougall program, we see continued success and even more improvements in their health.
I came to McDougall Immersion in March of this year. When I got here, I type 2 diabetes, high blood pressure, really high cholesterol, was on 2 different diabetes medications, Lipitor for my cholesterol and lisinopril for high blood pressure. I lost a couple pounds while I was here, and in the last 7 months or so since, I've lost about 62 pounds. Completely reversed the diabetes. My waking blood sugars are generally around 75, 80 every day. I stopped taking measurements after 3 months of those readings. My life's completely changed. I have tons of energy. I feel fantastic. I can finally beat my 6-year-old in a race, which is a nice thing.
When you bring Dr. McDougall's program into your company, it inspires other employees to get healthy too.
There's a gentleman at my store, Tim Bennett. He went last year, he's lost over 80 pounds, and then he came back and he taught it to both his brothers, and one of his brothers has lost 120 pounds.
There's a woman named Nancy who is in our produce department, and I think she's lost probably at least 50 pounds. She looks great, she feels great, it's changed her life.
One of the great things about talking to my friend who came back from the McDougall in March was I could see in his face he'd lost 30 pounds.
And I saw the changes in them, and I just wanted to do it.
The physical, emotional, and financial costs of lifestyle-based illnesses are astronomical and continuous.
And these are very expensive diseases that only get more expensive. Once you have your heart attack or once that diabetes produces blindness or kidney failure, a whole snowball of expenses begins rolling downhill.
The problem is people are sick because of what they eat. And that's a simple thing to change. Given the right information, given the opportunity, given an intense exposure to this kind of information, people change.
These things reverse fairly quickly. Diabetes, 30 to 90 days. You've seen it happen again and again and again. Heart disease, angina, it disappears within just a couple of weeks of changing your diet, and the body wants to heal itself.
During the program, I realized that I do have a choice which way my health is going, and I do have a choice to change.
I think it's pretty incredible what Whole Foods Market offers this benefit to our team members, that we're able to come and learn about basically how to eat and how to be healthy.
Before, I just almost thought, well, this is kind of the aging process, and there wasn't really much I could do except hope that I had good genes and I would kind of be one of the lucky ones. Now I feel like I can be a lucky one by really just being much more proactive and taking ownership of it.
The highest cholesterol drop was 108 points. In 6 days, can you believe that? In 6 days.
By far the most effective way to try to help people make real lasting changes and that are significant is to give them an experience where they have coaches and co-workers and a process where they learn by doing. And the McDougall program, where they live in here and they go through this process with us, this is going to be the most effective way for people to see changes for themselves and for companies to see changes with their people.